Baby Steps is a healthcare hero because it's an innovative nursing model that we've created to transition babies and families from the NICU to the home. Nobody plans on being in the NICU when you have a newborn. Once they're ready to go home, it could be very scary for them to not have the same support system that they had while they were admitted in the hospital. Baby Steps is a telehealth program where we have a specialized NICU nurse that meets the families in the NICU before discharge and gets to know them at a very personal level. Parents have access to connect with a NICU nurse for those first 2 weeks after being discharged from the NICU. This has helped us decrease the amount of babies that get readmitted into the NICU by 50%. It has also decreased the amount of emergency room visits by 50% and urgent care visits by 50%. It's part of our goal and our mission as a NICU nurse to not only see these babies grow and thrive, but to see them go home and actually become part of the family at home.
So 70% of line of duty deaths in the fire service are associated with cancer. It actually is the #1 cause of line of duty deaths among firefighters in the United States. The Firefighter Cancer Initiative was developed to understand what accounts for this disparity and, more importantly, to generate the solutions. And over time, it has grown into the best example that I can think of citizen science, where science has really driven practice and policy change in such a short period of time. And those changes have undoubtedly led to greater awareness about cancer in the fire service and to practices that reduce exposure to occupational carcinogens that are associated with increased cancer risk among our first responders. For most of us who've been involved with the Firefighter Cancer Initiative over the past 10 years, we would say that this is the greatest privilege of our career, because doing science that translates to action, that changes lives, is why we do the science in the first place.
Social determinants of health, including housing crisis, food insecurity, financial instability, lack of transportation, mental health needs, substance use, make it difficult for people living with HIV to show up to their medical appointments and take their medication every day. Project DARE team works with those participants to identify and address those barriers so they can reach their best health outcomes. When we cannot offer a service, we refer outside to partners and organizations that can help our clients, because we offer unlimited overrides to and from their appointments that they can request at any time. The combined benefits generated by Project DARE greatly exceeds the cost of providing medical treatment and wraparound services for people living with HIV. The return on investment of the project is 762%. By helping more people be virally suppressed, we actively prevent further infections. We hope that similar initiatives will multiply and one day we can see the end of the HIV epidemic.